48-year-old female complaining of chest pain is admitted to the med-surg nursing unit for acute coronary syndrome. The cardiologist prescribes a continuous IV heparin infusion per protocol. The client weighs 165 pounds, which is 74.8 kilograms, and baseline PTT is 32 seconds. All right, so let's stop right here. First of all, we need to know what is heparin, right? We need to know what is heparin, and we need to know what is PTT. If we do not have the content, the knowledge of those two things, guess what? We kind of screwed, right? So it says a bolus is administered as prescribed and continuous infusion is initiated based on the protocol noted on the patient's MAR. All right. So basically the MAR, it just goes to show you, hey, this is what you do when that patient PTT comes back. So we really don't have to read that now until the end. All right. So it says that the next day, the oncoming nurse assigned to the patient, they monitor the patient and checking their labs, right? The client says, I feel okay. I just had a hard time sleeping since I've been in the hospital. My chest pain is better. I had a nosebleed this morning, but it stopped. I'm ready for breakfast. It should be here soon. The most recent PTT was done an hour ago, and it was 92 seconds. The heparin infusion is still running, and it's running at 13.5 mLs per hour. So let's go back up with that 92 seconds, and let's go back up to our MAR. So our PTT says this is how long it takes our blood to clot. So if it takes your blood longer than 90 seconds to clot, no bolus and stop the infusion. What is heparin? Heparin is a blood thinner. All right. So the question then says, select 3 priority needs that are of immediate concern, meaning we need to do something about these 3 things right now. I'm going to give you guys a chance to answer. All right, so let's go back to the original problem, right? Let's go down to the paragraph at the end. So I'm concerned with this patient having a nosebleed. I'm concerned because this patient is on a blood thinner and they had a nosebleed. So before I even knew the PTT number, I knew that the PTT was going to be off. I knew it was going to be high because that patient had a nosebleed. So we need to pay attention to the nosebleed, the PTT, and we need to stop the infusion. So the answer choice is nosebleed, PTT results, heparin infusion. All right, let's talk about why the other ones are wrong. Appetite. The lady said that her appetite is better, right? She actually said she's ready for breakfast, right? With her chest pain, she said that her chest pain was better. You having a difficult time sleeping in the hospital? I'm sorry, that is not priority. So do you see why those 3 were chosen? In any other instance, chest pain would be a priority, but not in this situation because the lady clearly stated that her chest pain was better. All right, great job. I know you guys got it right.